bone to the ramus of mandible. The other important part in the lateral view of skull is the ramus of mandible, and it will be described briefly here because it lies within the middle region of this view of skull. Mandibles are shaped like this, and there is a lower teeth on the mandibular body like this. The ramus is a plate of bone projecting upward from the body. This is the body of the mandible, and roughly here is a ramus of mandible. The ramus is a plate of bone projecting upward from the body of the mandible. Its lateral surface gives attachment to the masseter muscle, and the ramus bears two prominent processes superiorly. One is the coronoid process here, and the other is the condyla or condyloid process here. Separated by the mandibular notch. This is the mandibular notch. The masseter muscle attached in this area is the masseteric tuberosity. The coronoid process is the site of insertion of the temporalis muscle, like this. And the condylar process or condyloid process articulates with the mandibular fossa of the temporal bone, like this. And there will be an external acoustic meatus and the tympanic styloid process and the mastoid process of the temporal bone, like that. And this is the mandibular fossa, which is located at the temporal bone. And this joint is the temporomandibular joint. The inferior and posterior border of the mandible meet at the angle. So this area is the mandibular angle of mandible, or gonial angle. It is more commonly splayed in the male, reflecting the larger site of attachment for the medial pterygoid muscle on the internal surface. You cannot see in this figure the medial pterygoid muscle because it is located inside of this figure. As I said, there are 6 notable structures in the ramus of mandible. The first one is the angle of mandible, or mandibular angle, and condylar process. And coronoid process, and mandibular notch. And oblique line, and masseteric tuberosity. Among these, I didn't explain the oblique line in this figure. Okay. Angle of mandible this angle of mandible, a ramus on the left and the right side, the rami, the plural form of the ramus, rise up from the body of the mandible and meet with the body at the angle of the mandible or the gonial angle. And the condylar process. The condylar process or condyloid process is the process on the human mandible which can be classified in head and neck. In this figure, this is a head and this is a neck. The condyle present an articular surface for articulation with the articular disc of the temporomandibular joint. In life, there is a articular disc between the mandibular fossa and the mandibular condyle, and the mandibular fossa is the structure located in the temporal bone, not in mandible. And it is a convex from before backward and from side to side and extend farther on the posterior than on the anterior surface. The neck is constricted portion, a little bit constricted portion compared to the head, supporting the head and flattened from the before backward and straightened by the ridges which descends from the forepart and side of the condyle. Its posterior surface convex. Posterior surface slightly convex, and an anterior surface has a depression for attachment of the lateral pterygoid muscle. This region we call as a pterygoid fovea. Pterygoid fovea. The coronoid process. The coronoid process is a thin triangular eminence. Which flattened from side to side and varies in shape and size. Its anterior border is a convex. It is not expressed well in this figure, sorry, but convex is continuous below the anterior border of ramus. This is the ramus, so it is the anterior border of the ramus. Its posterior border is a concave and forms the anterior boundary of the mandibular notch. This is a slightly concave, and this is the mandibular notch. The next, mandibular notch. Mandibular notch is the upper border of ramus of mandible. Is a thin and surmounted by two processes, the coronoid process anteriorly and condyloid process posteriorly, as I said, separated by the deep concavity. This deep concavity is the mandibular notch, or sometimes it is called as a sigmoid notch. It allows the passage of the mesenteric nerve, which is one branch of the mandibular nerve, division of the trigeminal nerve, and the mesenteric artery and mesenteric vein. The next is oblique line, running backward and upward from each side of mental tubercle. Mental tubercle is around here, and it's a faint ridge, the oblique line, which is continuous with the anterior border of the ramus. Like that. This is a oblique line. This is a mental tubercle. It affords attachments to depressor labii inferioris muscle and depressor anguli aris muscle, and the platysma is attached below this line. The final one is mesenteric tuberosity. Here is a rough area for the attachment of the masseter on the external surface of the angle of the mandible. Now let's talk about the sutures found in the lateral view of the skull. If we know the names of individual bone, the suture's name is very easy to memorize. The first one is the frontozygomatic suture. And the second one is the zygomatico-temporal suture, which is located on the zygomatic arch. And the third one is the sphenozygomatic suture, which cannot be seen well in this figure. Actually, this line is located more medial to this frontal process of zygomatic bone. And the fourth one is the spinofrontal suture here. Spinofrontal suture. The next, we have spinoparietal suture here. And the spinosquamosal suture here. This part is the scoma or squamous part of temporal bone. So this suture is spinosquamous suture and not the spinotemporal suture. And the squamous suture is this, just squamous suture, and the junction of the junction between the squamous part of the temporal bone and the squamous border of parietal bone. This is the squamous border of parietal bone. And the parieto-mastoid suture. Parieto-mastoid suture is here. This is the mastoid region, whole part of temporal bone. So this suture is parieto-mastoid suture, and the occipito-mastoid suture is here. This is the occipital bone, and this is the mastoid part. So the this suture is the occipito-mastoid suture. So we have talked about the 9 sutures, but to speak strictly, there is more sutures such as coronal suture or rhamnoidal suture. And other sutures are located in the inside of orbit. These sutures can be seen or not according to the geometry of individual skull shape. But these 9 sutures are important sutures, and we have talked about in this session. Many anatomic landmarks found in the lateral view on the skull, and we will cover only the important ones. First one is the orbitail. Here, the lowermost point in the lower margin of the bony orbit. It may be palpated under the skin by our hand. The abbreviated form is the OR, and the frontotemporal, which is the craniometric point located at the most anterior point of the temporal line. Temporal line is located like here as a superior and inferior temporal line, and the most anterior point of this temporal line in the frontal bone. So this is the frontotemporal. And the next one is the important one, the gonion. The gonion is located here. At the apex of the jaw angle, mandibular angle. It can be used for the localization of the marginal mandibular nerve, which runs along the inferior margin of the jaw. The next one is a zygion. It's the most lateral point of the zygomatic arch, probably around here. But it cannot be detected in this figure. It's a 2D plane because it is usually used in the frontal cephalometric AP, anterior posterior cephalometric radiographs in the treatment planning or the evaluating the orthodontic surgery, especially in the case of the asymmetry. But there, if there is a zygion in here, there may be this point may be around here. Okay, the next one is the pterion. Pterion is corresponds to the area where the large sphenoid bones wing, sphenoid bones greater wing articulates with the parietal bone, frontal bone, and the squamous part of the temporal bone. It is H-shaped, so it can be depicted like this, and the definition of the pterion is variable according to the literature, but usually the pterion can be pointed here. There are 4 morphological types of pterion according to the literature: sphenoparietal, frontotemporal, and sterine epithelial. So some authors, this one is a pterion or this one is a pterion, but in these lectures we denote the pterion is the anterior point where the frontal bone and parietal bone and sphenoid bones meet. And the next is a porion. Porion is also important point which is located around here, at the highest and most external point of the external acoustic meatus. It is a landmark for the frontotemporal branch of the facial nerve, and also it is used for the defining the Frankfurt horizontal plane with the orbital. And the next one is the auricular. It is a little bit ambiguous point. In cephalometrics, the point of intersection of the external dorsal contour of the mandibular condyle, this line, and the intersection of this line with the temporal bone. So this point is auricular. Which is not prevalently used in orthodontics actually. The next one is the mastoidal, this one, and the lowest point of the contour of the mastoid process. And the next one is the asterion. Asterion is located at the confluence point of the lambdoid suture. This is the lambdoid suture and the parieto-mastoid suture, this one, and the accipito-mastoid suture, this one. And the asterion is located in the confluence of this point. So this is asterion. The abbreviated form is the AST. Okay. The next is a inion or inion. Inion is the craniometric point which corresponds to the external occipital protuberance. So it's a little bit other descriptions. This is the inion eye. And the next one is the ophistocranion. Ophistocranion is corresponds to the most posterior point of the occipital bone. So in this figure, here is the ophistocranion. Ophistocranion. It is located at the level of the superior occipital squama, and only rarely it corresponds to the external occipital protuberance. In this case, the inion and the ophistocranion is coincide, but it does not happen frequently actually. Ophistocranion is also defined as the most distant point of the cranial bolt from glabella, which is located around here. And the next one is the bregma. The bregma is the craniometric point located at the junction of the coronal and the sagittal sutures. So this is the bregma. And menton. The menton corresponds to the lowermost point of the mental tuberosity. So this point is menton. And the next one is the pogonium. Pogonium corresponds to the most forward point of the mental tuberosity. So this point is the pogonium. And the Neptune is here between the pogonium and menton, as I described earlier. So this is the end of the lateral view of the skull, and thanks for watching.